morning. I'm Erica.
I'm Irina.
I'm Sarah.
And our faculty mentor is Dr. Aldoory. And we're going to be talking to you today about our initiative to improve family physical activity among parents of preschoolers. So why is this important? 15% of preschool-aged children are already obese. So as you can see, the obesity epidemic impacts individuals very early in life. And obesity can lead to health problems like diabetes and cardiovascular disease, but we know that physical activity can reduce these risks. And scholars have identified that among preschoolers, parents can and do play a significant role in their activity levels.
So our vision was to create messages that help parents fit family physical activity into their everyday lives by using two-way text messaging as seen on the slide. The messages would be conditional or tailored to factors such as parents' preferences and resources. And I'm going to walk you through that slide. So parents enroll in the program because they think receiving ideas about what to do with their kids would be helpful. For example, we send them a message asking them if they want to be active inside or outside. Let's say the parent replies with a 2, meaning that they want to be active inside. And as you can see, our response would be tailored to meet that parent's choice.
So we wanted to create a product that would deliver credible health information to parents who may struggle to find accurate and trustworthy information about their family's health.
And we know that mobile texting continues to grow, especially among racial and ethnic minorities. And when looking at cell phone owners, only 1 in 10 have a health-related app, but 81% use text messaging. So disseminating health information via text can help to close this digital divide.
And interactive texting is a novel approach to disseminating expert health information in a more usable and accessible way. Unlike traditional health education campaigns, it also enables users to share information with the messaging system.
So during this project, our team followed an iterative, user-centered approach to develop and evaluate the message library. We started by drafting sample messages and getting feedback from parents through focus groups. We then developed a pilot message library and conducted a week-long pilot test. After completing interviews with pilot test participants, we are currently refining this message library.
Our focus groups were held in community settings in Prince George's and Montgomery counties with a very diverse group of participants. The purpose of the focus group was to gather input on content and interaction. And during the focus group, we heard things like,
for example, one Caucasian mom said, "I like the idea of reminding that that's just something you can do, just jumping jacks or a quick game of hide and seek."
And an African-American father told us, "I don't know what type of luxurious home you live in, but I don't have many hiding spaces, so hide and seek would be over with extremely fast. I'm in a one-level Rambler, so there's really nowhere to go."
So as you can see, it was clear that message tailoring would allow parents with different preferences and resources to get information that would be relevant and useful to their everyday lives. So we used the findings from our focus group to inform the development of our text message and the tailoring logic that we used for our pilot study.
We used Google Voice to send 7 days of interactive messages to participants, and a sample exchange is shown here. The messages were sent at different times of the day and included activity ideas, health facts, and support, and also zip code specific events. After the week of messages, we interviewed participants to gather feedback on satisfaction, usefulness, and behavior. Feedback was generally very positive, with participants appreciating the interactivity and many reporting that they had actually done the activities with their kids.
One Hispanic mother said, "I didn't know if you guys specialized or study what kids like, but I loved how my daughter was so excited knowing we were going to do an activity with the balloons. Here, mommy, here, mommy."
So what does all of this tell us about the future of information? First, we know that parents appreciated messages with curated health facts and links to local resources. So this tells us that we can successfully guide people to credible information sources. Also, our diverse group of participants shared their values and beliefs. So for example, some Hispanic mothers said that they wanted to hear that engaging in physical activity with their child is part of being a good parent, while Caucasian parents preferred to avoid messages that they saw as judging their parenting skills. And we found that parents across different racial and ethnic backgrounds generally found our pilot messages to be credible and relevant. Finally, we found that people are willing to share information by text with a trustworthy source. And this has significant implications for public health's ability to gather big data in real time and monitor health trends.
So what about equity? We found that across different groups of parents, although all had smartphones and internet access, they did not all use technology the same way to access information. For example, parents from wealthier communities were more likely to mention sharing information with other parents through community listservs. Texting can help reach communities who lack information resources despite having technology. Another implication of our project is the success of tailoring information based on people's resources and needs. In the future, we envision sort of a Pandora model where the system learns over time what types of messages are most relevant and appropriate for the user's everyday life.
Finally, texting is an incredibly simple and powerful tool for sharing information. Parents really liked the interactivity of the messages and said the text created a sense of urgency but without being intrusive. We recommend a hybrid system with message automation, but the ability to contact the human for support and to provide additional feedback. Also, tailoring worked so well that we can see many additional factors to tailor on as the message library grows. For example, the preferred time to receive your daily tip. And finally, texting is a part of everyday lives. There is potential to integrate SMS data into other quantified self-tools such as tracking dashboards.
So our next steps include growing our message library and creating an automated system that tailors and delivers messages according to the specifications we found valuable through this pilot. We've already had some conversations with Sesame Workshop and intend to follow up with them as well as the National Park Service regarding partnering in the future for additional funding. And we'd like to seek funding to support the expansion of our pilot message library, which our partners could disseminate through their existing channels.
As well as funding to support the development of a fully automated system which could support sophisticated interactions by partnering with experts from information science and computer and systems engineering.
Importantly, we know that our promising findings from the pilot study are only preliminary data. So we also hope to secure funding to conduct a rigorous evaluation of our initiative to assess how the messages support behavior change. Our team is very grateful to the Future of Information Alliance and the Deutsche Foundation for the chance to seed our initiative.
Questions? Yes.
How large was your study base? What was the end? How large was your study base?
For, I think the focus group was 16 and the pilot was 16, and then go ahead.
We had 17 participants enrolled in the focus groups and 16 participants enrolled in the week-long pilot test. There was some overlap, but we did have some participants in the pilot test who had not participated in those focus groups.
Other questions? I'll throw one in. You mentioned early on zip code specific data, and I'm interested to know more about that and the degree to which that requires a human hand and the degree to which it could be automated over time.
Sure. So we knew sort of because of our focus groups where our populations were coming from. So before we sent out the text message that asked for their zip code, we spent some time looking up activities for that weekend for different zip codes that we could possibly get. And we sort of looked in the DC range because most of the parents we talked to during the focus group said that they'd be willing to travel a little bit. They had cars or take the metro. But yes, when they would text message their zip code in, we would sit there and make sure that we had something accessible to them. But that zip code sort of tailoring was very, very well received.
Well, thank you very much. Great project. What's that? What's that? Oh yeah, could you just say what disciplines you're from, please? The colleges?
I'm Sarah, and I'm from the School of Public Health in the Department of Behavioral and Community Health.
Ditto.
Not Sarah, but I'm Erica.
And I'm Irina. I'm a doctoral student in the Department of Communication.
And I direct a Center for Health Literacy and then also in Behavioral and Community Health in School of Health.